Assalamu alaikum. Bismillahirrahmanirrahim. I am Wasim Amin, host for this event, and I have brother Muhammad Rizwan, who shall be the co-host. Let us start the event with Kirat by Master Ayub, son of Shamshir Ahmad. Over to Master Ayub.
السلام عليكم.
وعليكم السلام.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون. And secondly, we shall test you with something of fear, hunger, loss of wealth, lives, and risks. But give glad tidings of Sabirun, the patient, who, when afflicted with calamity, say truly to Allah we belong and truly to Him we shall return. Sadaqallahu al-Azim. Chapter 2, verse number 155 to 156. Jazakallah khair.
MashaAllah, it was very pleasant to hear from you. Jazakallah khair, Master Ayub. We heard many news on Corona, especially on WhatsApp, and many turn to be fake. The end result of fake news is fear and panic. We are in the verge of community spread of COVID-19. It is advisable to seek guidance from our expert doctors. Inshallah, NMH Alumni doctors shall explain the scenario, precautions, and myth covering COVID-19. The event is for 60 minutes and is divided into two. The first half, we will have speeches from our expert doctors for 30 minutes. The second session shall be question and answer session. Inshallah, we will move on to our first speaker, Dr. Ayahs Ahmad, MD Pediatrics, currently working at Bowring Hospital in Bangalore. Over to Dr. Ayahs Ahmad. I will share your slides now.
Shall I start, Wasim bhai?
Yes, sure.
Yeah. Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullah.
Yeah. Today, me and Dr. Asif bhai and Dr. Asif Iqbal will be speaking. And my topic for today's subject is regarding coronavirus. I'll be mainly speaking about the coronavirus and its current scenario right now. I'll be concentrating more on Bangalore. Next slide, Wasim bhai. Yeah. Coronavirus is a large virus. It usually there are many symptoms of common cold to severe respiratory symptoms can occur with this one. So we have seen coronavirus like from the past almost 100 years. There are in the severe acute respiratory syndrome, Middle East respiratory syndrome, and now SARS-CoV-2. That is what we are seeing as of now. This next slide. Yeah. Coming to the history, next slide. Next slide, Avasim. Yeah. Coming to the history of this pandemics, like we have seen many pandemics right from the year 1340, when there was plague pandemic was there, it had affected almost 1/3 of European population. And in the past 100 years, we have seen almost 4 pandemics. The first was the Spanish influenza, which occurred in the year 1918, and it had infected almost 1/3 of the population, and there were around 40 million casualties reported. Second was Asian influenza pandemic, that was 1957, and third was the Hong Kong influenza, which occurred in 1968, and swine flu, which was Mexican or USA, it was 2009. Most of this, almost all of the pandemics ran through many years, and we can see like many casualties happening during these pandemics. And these pandemics usually occurred because of the virus, which was taking antigenic shift, what we called as antigenic shift and antigenic drift. Means what happens is usually viruses which are lodged in the animals, because of these viruses are infected from like transmitted from the animals to human beings. Then certain mutations happen, and these causes these pandemics. Next slide. Yeah, coming this slide, we can see that SARS, which I was speaking, this is the coronavirus which caused SARS in the year 2009, had infected almost 8,096 people with a mortality of around 1,774. The mortality rate was around 15%. And MERS, which is called as Middle East Respiratory Syndrome, it had a mortality of almost 37%. The persons infected were almost 2,500 with 850 people dying because of that one. Coming to coronavirus to SARS-CoV-2, there are like today's, this is the old stats, 7th Feb. Coming to today's stats, there is almost affected 1 crore people, and we have reported around 5 lakh casualties. It's coming to around 5% of the casualty. The infectivity rate of coronavirus, this is SARS-CoV-2, is very high compared to this one, but mortality is bit on the lower side. Next slide. Yeah, this is what we call as incubation period. Incubation period is what we like from the time we get infected and to appearance of the symptoms, we call it as incubation period. It starts, we are between 2 to 14 days, and any person can be like get infected like with from the like 2 days prior to getting symptoms, and it can last up to 8 days after getting the symptoms. Next slide. Yeah, these are the common symptoms of coronavirus, COVID-19, starting from fever, cough, fatigue, sputum. Like you can have as mild as symptoms like fever and cough, to respiratory, like very much respiratory distress, the difficulty in breathing, even diarrhea can be there, even vomiting, and usually we may have loss of sensation, loss of smell sensation, loss of taste sensation 1 or 2 days prior to onset of symptoms. Yeah, next slide. There is something called as common flu, what we call as common cold, what we get, and there is COVID-19. These are all like almost viral infections. Similarity is this, like both are caused by almost viral infections, and they are spread by almost like droplet infection. Droplet infection means when we sneeze or when we talk, whatever that droplets we spit out, that one. And this can be prevented by same methods like hand hygiene, social distance, and keeping this one. And the main difference is infectivity of normal common cold is very fast. Like a person gets infected, he can spread it very fast to the other person. Whereas in COVID-19, it's like it doesn't take that much. It takes 1 or 2 days to spread. And the reproductive number in COVID is 2.25. Means it's more compared to pandemic influenza. And children are less affected with COVID compared to common flu. And severe deaths and illness is reported with COVID-19 cases. Yes. Next slide. Yeah. Yeah, this slide, like as most of us know that the first case of this COVID-19 was reported in Wuhan province of China around mid-December. So in India, we had our first case around January last week that was reported in Kasargod. Three medical students who returned from Wuhan, China, had symptoms and they were admitted and they were cured. Subsequently, this went on increasing, and coming to this today's statistics, like India, we have around 5 lakh cases of
Hello?
confirmed COVID cases. Next slide.
Hello, yes.
Hello. Yeah. This is the stats of Karnataka, where we can see day by day cases are increasing. So this is divided like today's statistics. According to that one, it's around 11 to 12,000 cases are there in Karnataka reported confirmed cases, among which Bangalore urban is topping, and even Gulbarga, Yadgir, other districts are also not far behind. Yeah, next slide. Next slide, Vasim. This is the of Bangalore. Yesterday itself, we can see that we had around 923 cases. From 8th of November, like when we reported, Bangalore reported first case, the cases are continuously increasing, and with almost 80 to 82 deaths. And in fact, we had the first death of India reported in Karnataka, that is Gulbarga. We had the first case, first mortality of COVID-19. And to like as we can see that day by day the cases are increasing. Next slide. Yeah, these slides, I'm just trying to compare what is the scenario today. See, we can see on the left side, see that is 31st of May, we had a lot of cases being reported in North Karnataka. Yeah, we can see that most of the cases, whatever is there, those are returned from Maharashtra. Backside. Yeah, most of the cases were reported from Maharashtra. Those who had travel history, like those who are coming from Maharashtra, those are the people. Those almost 90%, 99% was asymptomatic, means they did not have any symptoms. They were not kept in hospitals, but they were kept in some hostels or some hotels, something like that. And they were asymptomatic and they are cured. Whereas on the right side, we can see 26.6. This is 2 days back scenario. You can see on the right side extreme, there is something called as influenza-like illness. This is what is called as like people are developing symptoms and they are turning positive. This is where we doctors, means everyone was fearing that community spread should not happen, which unfortunately has happened everywhere, almost in Karnataka. So we can make out that almost all 80% of the cases are because of community spread. Yeah, next slide. This is like more for what we call when you suspect a case of COVID-19. So any patient, any person having a symptoms of respiratory symptoms like cough, there should be fever and cough should be there. Fever should be there and cough should be there, and there should be either of the things. There should be a history of travel to an area where there is COVID-19 is this one containment zone, or he should have come in a person with COVID positive case. He should be contact, or he should have symptoms like cough and cold with shortness of breath, or he should require hospitalization. So probable case is when we don't get the result, and confirmed case is when the test is positive. Yeah, next slide. Yeah, this is what is being followed. Like I'm just highlighting what is being followed right now in Karnataka and most of the this is more to Bangalore, and also like I have mentioned the hospitals in Bangalore, and it's also in Karnataka. This is also the same protocol being followed. What we are dividing the patients right now is we are taking the patients into mild, moderate, and severe. Mild patients are those who do those who are like COVID positive, either there is fever and cough, but they are stable patients. Moderate patients are those who have pneumonia, that is like bit of we say respiratory rate, thoda cough is there, and he is not able to maintain saturation. Such patients we are admitting, and the severe is those who require like ICU care, something like that. So what go back. Yeah, what government is doing right now is like we have divided, the government has divided into COVID care centers. What you can see on the extreme left down is we see Hajj facility. This is the Hajj Bhavan in Bangalore, and Sri Ravi Shankar Ashram, which is in Kanakapura Road, and Continue Industrium. So patients who are stable, asymptomatic, those are patients, means those COVID positive patients are being admitted there and observed for around 10 days. This is what is happening in Bangalore and around in Karnataka. And the patients who require, like who are symptomatic with cough or fever, they are admitted in hospitals where these are called as COVID care hospitals, where their general care is taken off. And on the extreme right, those are the patients who require ICU care and constant monitoring. They will be admitted under like major hospitals of Bangalore, like Victoria Hospital, Boring Hospital, Rajiv Gandhi Chest and Tuberculosis Disease Hospital, and few of the private hospitals. So next slide. Yeah, thank you.
Thank you very much, Dr. Ayaz Ahmed. It was wonderful to have the introduction and current scenario of COVID-19. Our next speaker is Dr. Asif Ali, MD, General Medicine. He is also the Associate Professor of Medicine, KBN Medical College, Gulbarga. He is also the Chief Consultant and Managing Partner, Bahamani Hospital, Gulbarga. Over to you, Dr. Mohammad Asif Ali. Dr. Asif, you need to unmute, please.
Yeah. Yeah, I think I'm audible now.
Yeah, very much.
Hello.
Perfect.
Yeah. Okay, guys. Right. So, Assalamu alaikum wa rahmatullahi wa barakatuh. It's nice to be a part of this event. And without wasting much time, I'd like to straight away go with my talk. I couldn't prepare PPT slides, but I would like to discuss in short regarding the mode of spread of this COVID-19 infection and the preventive measures to be taken, how to stop the spread of this virus, or how to get in and how to prevent oneself from getting infected from this virus. Regarding this mode of spread, this virus mainly spreads through air. We call it as airborne spread or aerosol spread. This airborne spread is, it mainly happens when someone coughs or sneezes. That means a person who is infected with COVID virus, when he coughs or sneezes, he will produce a lot of, contaminated particles. We call them as aerosols and we call them as droplets. There is some difference between this aerosol and droplets. To clarify, aerosols are very fine particles which are less than 10 micron meters, which are very small size, and they can hang up in air for longer duration. So whenever a infected person coughs out, he will produce a lot of aerosols as well as droplets in the air. But the aerosols being lighter particles, they remain suspended for longer duration in air. And the droplets, which are slightly larger in size, we define a droplet when it's more than 20 micron meter in size. They embed the virus particle, but they won't spread for longer distances. And this aerosols, that is the droplets and aerosols, they remain in the air. And whenever a healthy person inhales this contaminated or infected aerosols or droplets, a healthy person will get infected from the virus. So the major mode of transmission is airborne. Just I would like to highlight here. The next major mode of transmission is by surface contact. That whenever someone touches a contaminated surface, a surface gets contaminated when an infected person coughs or he touches his hand on any object, and the viruses tries to survive in moist and humid condition for a longer duration as compared to temperate or dry conditions, and it can survive on almost any object. So whenever we are using an object, we should clean it properly, disinfect it, and we should maintain personal hygiene on our part also to spread of the infection. this surface contacts again mainly occurs whenever someone coughs and sneezes. These droplets, they try to stick to the surface of the walls or on the the doorknobs as well as other surfaces. So when a healthy person come in contact with this contaminated surfaces, he contaminates his hand and he try to infect himself by touching his nose or mouth. So that's why we say, please do not touch your nose or mouth very frequently whenever you are outside. So try to avoid these surface contacts. And there are other modes of transmission apart from this aerosol route and the surface contacts, such as from the mother to fetus. Though very rare instances have been reported. So we'll not discuss that part here because this is mainly for doctors and for research purposes and all. But it's not to panic. Someone is pregnant that the child may have COVID-19 and all. There are very less chances. And the virus can also be transmitted from mother's milk to the child, they say, but the instances are very less and they don't have exact documentation how much is the percentage of transmission. And next major mode of transmission, they say, is from the excreta of an infected person. That is, whenever a person defecates and he goes to the toilet and he flushes, it's try to create a lot of aerosols and all from that contaminated surface or from that contaminated toilet. If someone healthy person who uses the toilet next can get infected with COVID-19 infection. Apart from this, they also say that the certain insects like our house flies can spread the infection. House flies, they carry a lot of viruses and bacteria. As we know, they are responsible for causing so many infections. And COVID-19 can also spread from house flies as well. So, briefing it out, mode of spread mainly by aerosol route, that is by coughing and sneezing. Secondly, by surface contacts. And third, there are so many other routes of transmission, what I have briefed here. Coming to the prevention of the spread of this COVID-19 infection, the first and foremost thing is maintaining personal hygiene. Personal hygiene in terms of maintaining the hand hygiene, that is washing our hands frequently. Whenever our hands get contaminated with some dust or particles from outside, wash it with a soap. Or when the hands are clean, you have come from outside or you have done some activity outside and you're coming inside home, better to use a disinfectant. So hand hygiene is must to prevent the spread of virus from one person to another. And we should maintain the cough etiquettes. Cough etiquettes, what I mean to say here is, whenever someone coughs and sneezes, he produces a lot of aerosols and droplets. So to avoid these droplets being suspended in the air and the infection gets spread to the other persons, we should cover our cough either by using a handkerchief or a tissue paper, or just simple by using your elbow. Most of the time they describe in videos and all, we all are aware, just cover your nose and mouth through your hand, and in this way you can avoid the spread of aerosols whenever you cough and sneeze. And that's the thing, we should make sure whenever we are outside we are using mask most of the time as a personal protection equipment, that is to protect ourselves and protect others from spread of these aerosols. If someone is infected, he'll avoid spreading the aerosols to other, and a healthy person gets prevented from getting this infection by inhaling these droplets as well. So the mask and other personal protection equipment plays an important role to prevent the spread of infection. So this preventive equipment should be used by specific persons. What I mean to say is, doctors are using this PPE kits and N95 masks and all, but for general public, I would like to highlight here that using a 3-ply face mask, which is easily available at lower cost, and it can be disposed on a daily basis. We should not use a mask for more than 6 to 8 hours as per the guidelines. So these 3-ply masks are very good and they're very feasible and affordable for general public. Most of the time I see people using N95 mask and roaming outside, and they're using that mask for months together. So that's not required actually, and those masks will be contaminated and you can spread the infection from outside to your home. Social other preventive measures like social distancing. We say that keep distance from one another. Whenever you go out, you have to maintain a distance of at least 6 feet or 2 meters. This is again to avoid this spread of infection through aerosols and droplets. So social distancing is one of the important norms to prevent the spread of infection. And whenever possible, avoid traveling. So traveling should be restricted, because as we can see that majority of the cases has spread from one country to another, from one continent to another, one city from another city is through travel. And this traveling is causing a lot of problem for spread of this infection. And now the current scenario, what we are facing is because of a lot of traveling in India, which is happening these days. For preventing the spread of disease and to stop the worsening of the disease, the most important thing is to consult a doctor whenever possible. Like, apart from taking care of all these things, if you have doubt that you have got some symptoms of COVID, as Dr. Ayahs has described already, that you have got fever, cough, cold, or you are in doubt with something, so better to consult a doctor and take an advice, right? How to prevent spread of the disease, and whether I'm having the symptoms or when I should test myself and all. They'll clarify all the details for you guys. So with this short discussion, I would like to end my talk and give chance to Dr. Asif Iqbal, who is presenting with more interesting topic of this COVID-19. So thank you one and all for patient listening. Thank you one and all.
Thank you, Jazakallah Khair. It was wonderful, well summarized on the mode of spread and precautions for COVID-19. Now our last speaker is Dr. Asif Iqbal. He has done MD Internal Medicine and also MRCP from London, currently working in Dubai. Over to Dr. Asif. I will share your slide.
Assalamu alaikum, everyone. Thanks for organizing this meet. And thank you, Dr. Ayahs and Dr. Asif Ali, for excellent presentation. I hope most of your brothers are quite aware of what's coronavirus now, and how is the mode of transmission and how to prevent it. Well explained by Dr. Asif Ali regarding the mode of transmission and prevention, which is very, very important in the coming days. So I would be talking about, with the COVID-19 pandemic, we have come across what is called infodemic. Like, there's a lot of information all over the world, shared in social media regarding coronavirus. Everybody wants to be an expert. There's a lot of information, but we don't know what's trustworthy or what is to be taken and what is fake. So I would deal with COVID-19. We look into myths and we'll try to debust all these myths related to COVID-19. Wasim Bhai, can you open the slides, please? So yeah, first of all, we'll clarify what is COVID-19. As Dr. Ayahs explained clearly, it is a virus, not a bacteria. So many would have, I myself received a WhatsApp forward a few days back saying, explaining beautifully what is saying that COVID-19 is not a virus, it's a bacteria, and the way it causes inflammation and the role of antibiotics. But we'll be clear that COVID-19 is a virus and not a bacteria. But the question arises, why do they use antibiotics sometimes? Sometimes with COVID-19, there can be a secondary bacterial infection, and there could be a need of antibiotic in severe cases with bacterial superinfection. But rest assured, COVID-19 is a virus and not a bacteria. And the mode of transmission, as Dr. Asif Ali explained, the mode of transmission, it is not transmitted by mosquito bites. So there are a lot of infections transmitted by mosquito bites, like dengue, malaria, and since with the monsoon setting in, there are infections caused by these mosquitoes. But the coronavirus, the SARS-CoV-2, is caused by the other modes of transmission as explained by Dr. Asif, and it's not transmitted by mosquito bites. So other very hilarious one which I received was spread through 5G mobile network. So this was most hilarious one which I found, and it is nothing to do with the radio waves, and as we already discussed, it is spread through respiratory droplets and contaminated surfaces. What about in places where there is hot and humid climate? So there was rumors, I mean, initially, before the pandemic set in India, people used to say that
next time
weather conditions in these tropical areas can resist the spread of this COVID-19. But the fact is that it can be transmitted in areas with hot and humid weather, and this virus is not killed by the high temperature or in countries where it's very hot or humid. So what I want to explain is there are some WhatsApp rumors or WhatsApp forwards where you may get that you can take a hot bath or expose yourself to temperatures about 25 so that you can kill the virus or you can prevent getting infected from COVID-19. But they have seen that as per the WHO CDC, it takes 56 degrees centigrade for almost 15 minutes to deactivate this virus, but they still can transmit. So this infection can spread in hot and humid weathers, and it is not killed by taking hot bath or exposing yourself to very hot water bath, and that can cause injuries and skin burns. Next slide. This is what we discussed. So don't take a hot bath to disinfect yourself from COVID-19. Next slide, please. Yeah, now going to the, as hot and humid weather doesn't help to prevent this COVID-19 spread, the cold weather also doesn't kill the virus. So it is spread throughout the world, even in countries with very cold temperatures, and also in countries with hot and humid temperature conditions. Next slide. So does the coronavirus affect older people, or younger people are also susceptible? As you know, it affects all age groups from children to old age people. But as we've seen from the experience and a lot of from studies all over the world, the elderly population is much more affected. They get into serious complications, and also individuals with other comorbidities or other illness like asthma, heart disease, or cancer. We call them as immunosuppressed. The immune system is weak. They are more vulnerable for a severe form of COVID-19 infection, and also the death in these patients these people are very high. So to be clear, it can affect all age groups from children to the elderly, but the elderly population are more susceptible for this infection. Now coming to the other one, how do you find out that you have COVID-19? So the being able to hold your breath for 10 seconds or without having any cough or just discomfort or doesn't mean that you don't have COVID-19. The only way to know that you have COVID-19 is, as explained by Dr. Ayahs, the symptoms, or anybody at present with this community transmission, anyone having fever should be checked. They all may not have respiratory symptoms. Some may have just a fever and non-specific symptoms like myalgia. Still, they should be checked for COVID-19 so that they can help the public by not transmitting the illness. So the only way to confirm the illness is by PCR test, an nasopharyngeal swab test. So there is no other methods to confirm by either holding your breath or saying that you don't have any respiratory symptoms doesn't mean that you don't have COVID-19. So since the community transmission sets in, I feel all with fever should be checked. and irrespective of other associated symptoms. And also again depends on the country's availability of testing or testing facility, and as per the local guidelines. So coming to others, I mean, now these are spicy ones. So we have a lot of WhatsApp forwards talking about pepper in soup or talking about turmeric, and there is no established evidence saying that adding pepper to soup or with hot meals, hot soup will prevent COVID-19. So it's always known what are the prevention measures to take. So all these soup wouldn't help you to prevent COVID-19 or treat COVID-19. The next one is very interesting. The garlic. I feel everyone would have got this WhatsApp forwards talking about garlic. Garlic is a treatment for everything from diabetes to hypertension, and that has intruded the COVID-19 treatment also. So a lot of people talking about garlic, although garlic is a healthy food, has some antimicrobial properties, but there's no definite evidence at present regarding COVID-19 prevention or any benefit for COVID-19 treatment. So look for all the symptoms of COVID-19 and consult your doctor. And I'm sure about alcohol. In the beginning of this COVID-19, there was some talk about alcohol protecting against the COVID-19. So as I feel everyone knows that alcohol doesn't have any benefit, and it's more dangerous and nothing to do with COVID-19. So what about disinfecting or spraying disinfectants or bleaching your body? Or spraying disinfectant to your body. You would have seen in the airports, they're spraying disinfectants as you pass through. This can, disinfect your things, your clothes or your carry bags, but it doesn't clean, or it doesn't clear the infection which you carry with you. So this is not a mode of prevention. It is followed in areas to disinfect objects and not prevent or treat infections carrying within an individual. So what about thermal scanners? And yeah, I mean, there's people talking about saying that there are thermal scanners. So thermal scanner just detect whether you have fever or not. It doesn't say that you have COVID-19. The way you find, I mean, you detect COVID-19 is only by nasopharyngeal swab test, and these are used in airports, in malls, all over the place, just to detect people with fever and to isolate them, and not to detect COVID-19 infection. What about hand dryers? There is hand dryers effective in killing COVID-19? Never. Hand dryers wouldn't help you in killing the COVID-19 infection. So the hand dryers used in the washrooms, in the malls, will not prevent. The best way to prevent infection is hand wash with soap and water, as explained by Dr. Asif. And what is the problem with the mask? There are some people who come up with this theory of saying that wearing mask will cause carbon dioxide retention and cause oxygen deficiency. There's nothing like that. Wearing mask will prevent infection, and it is the best known preventive methods what we have now against this COVID-19. So use a mask as properly fit, and as Dr. Asif mentioned, 6 to 8 hours and not more than that, and not using N95 unnecessarily. What about exercise? The recent guidelines about COVID-19 with mask, they say that sweat can make the mask wet and can cause bacterial infection. So while exercising, try to avoid a mask, but it's important to maintain a social distancing. If you feel that you can't maintain social distancing in a park or in the exercise area, it's better to avoid exercise at this stage. It's more important to prevent infection rather than exercise in an area which is crowded. So if you can maintain social distance, you can exercise without wearing a mask, and the distance should be at least 6 feet or 2 meters. Does COVID-19 spread through shoes? No, it doesn't spread through shoes, but it's a good hygiene practice, or good practice to keep your shoes outside when during these in this situation of pandemic, rather than children getting playing with your shoes and getting infected again with other organisms. And coming to the next, what about rinsing your nose with saline? This helps to prevent stuffiness in nose. It's a common way of treating nose stuffiness due to any viral illness. So, but it doesn't have any role in treating COVID-19. And what about antibiotic treatment for COVID-19? As I told you, it's a viral illness, and there is no antibiotic for virus. Antibiotic is used for bacterial infection, and coming to and as I think most of you are aware of azithromycin now, and even people talk about all treatment drugs available for COVID-19 through this social media. They are aware of all medications used, like hydroxychloroquine, the azithromycin, and there are people propagating the use of azithromycin for COVID-19. So please avoid taking azithromycin, because in India it's easily available over the counter, but it doesn't help to treat the infection. Just taking azithromycin, it should be you should consult a doctor if you suspect to have a COVID-19, and not take over-the-counter medication or antibiotics. So are there any specific medication to prevent or treat the new coronavirus? Yes, I mean, there are a lot of guidelines now by the WHO and the FDA regarding the treatment. Although there is no specific antidote, there are some medications which have been approved, like remdesivir, but these are in severe illness, severe infections, and they say that it reduces this hospital stay for a few days, but there's no definite antidote or definite treatment. There are a lot of drugs tried for COVID-19 infection, and also recently there was a steroid dexamethasone which was approved. This, I mean, doesn't mean that you need to go out and take steroid as soon as you have fever. It doesn't. It is the decision of the physician when to give the steroid. It is given at a certain point of COVID-19 infection, when patient has respiratory distress, and there is a certain dosage to be given, and there is certain criteria to give steroid. So to be clear, there is no antibiotic which you can take if you have COVID-19. You need to consult a doctor, and you cannot take steroid also. So there is no definite treatment for COVID-19 as such now. The best mode of treatment is prevention. So as Dr. Asif mentioned, all the methods of prevention. What about vaccination? Yes, the vaccinations the trials are going on regarding COVID-19 vaccines. There is no definite vaccine available yet. What about other vaccines? Whether we can vaccinate our children during this COVID-19 pandemic? Yes, definitely. You need to vaccinate your children. Don't delay it. Try to see how we can do. We have, UAE government has started a lot of initiatives like walk-in. The nurse come to your car and give vaccine. We can look at your local guidelines how to get vaccinated. Even adults, like influenza vaccine, pneumonia vaccine can help you to prevent infections because of other virus, but not due to COVID-19. But if you're due for a vaccination, if your children are due for a vaccination, please get it done. Don't delay it. And to assure all of you, this COVID-19 infection, most people with COVID-19 infection have mild to moderate symptoms. We saw the pandemic in UAE quite early compared to India. We are already now in a downward trend where the cases are decreasing. The hospital I was working was a COVID center. Now we are non-COVID. And the number of cases we treated, most of them, almost like 80% of the patients had mild or asymptomatic patients, and they recover well. And 10 to 15% had moderate symptoms, like what Dr. Ayahs mentioned. Moderate symptoms means requiring oxygen, pneumonia, and 5 to 10% had severe illness, requiring ventilator, and the mortality was up to 2 to 3%. And thank you all. The message I want to pass on to everyone is just remember three things. One is the preventive modes. That's only one way which we can prevent this COVID-19. The hand wash, hand hygiene, face mask, the cough etiquette, and social distancing. Thank you. Thank you for an opportunity to talk to in this webinar.
Thank you very much, Dr. Asif Iqbal. Now we move on to question and answer session. So all the participants, I will mute everyone. So those who have questions, you can raise the hand. There is icon at the bottom bar. In the panelist, we have Dr. Hasib, Dr. Asif Iqbal, Dr. Muhammad Asif Ali, and Dr. Ayahs Ahmed. Dr. Hasib, can you check the chat box for any questions, please?
Assalamu alaikum.
You need to unmute and ask the questions.
Yeah, I have checked the chat box. I would request the speakers to throw some light on the questions of our participants. One of the participants had a question. He was inquiring about herd immunity. Can the speakers speak a little bit on herd immunity? Asif bhai?
You are on mute, Asif bhai.
Sorry guys. Yeah. Can you hear me guys? Yeah.
Yeah.
Okay. Yeah. Herd immunity is, a natural protective mechanism which is provided by the Most Almighty Allah Subhanahu wa Taala, that any person who get infected, if he has a power to fight with the disease, will develop antibodies and will be, not, surrendering to the disease, or he'll not manifest with dreaded manifestation, or he'll not have any consequences of the disease. So herd immunity is whenever the exposure occurs to a community to a greater extent. That means about 60% of the individuals will become immune to a disease. We call it as herd immunity. That means we have acquired herd immunity. And in this pandemic diseases, which are, rapidly spreading through aerosol route, it's difficult to contain this disease, no matter however equipped you are, or what country you are living in, whether developed, underdeveloped, whatever countries. So in this aspect, herd immunity plays a greater role. And that's why we say that people with, comorbidities like diabetes, hypertension, and if their age is above 60, or they are less than 10 years of age, they should not get exposed to this virus head on. Let the herd immunity develop. That means younger individuals who have a good immune power should be exposed to these viruses if they're going outside with protection also. And once they develop this immunity, they become a barrier to prevent the spread of the disease. So herd immunity is one of the important thing in, heralding the spread of disease, what I mean to say. If anyone, Asif or Ayahs, want to throw some light, please, you can go ahead.
Okay, if permit, I will go to the next question. The next question is, if a patient is admitted and he gets treatment for 21 days, and after getting discharged, whether can he get infected again?
Asif Iqbal, you can go ahead.
This is an interesting question. We come across this question very, very frequently, whether you can get reinfected again. There is no definite evidence, to say that you can get reinfected. The antibodies, once you develop antibodies for this COVID-19, once you recover, these antibodies, they say, gives protection for 3 to 4 months, but there's no definite evidence how long you are immune to this infection. And the rate of reinfection, as far as I know, is very low. If there's any more evidence, if there's any more than information, I'm not aware. But as far as I know, there is the evidence of reinfection is very low. And that's the role of this plasma therapy, where they use the plasma from a recovered patient to treat.
Asif bhai, Ayahs, you want to say something on this thing?
Yeah, definitely. As Asif said, that reinfection with the same virus is very less, because once someone develops immunity or antibodies, the virus will not affect again. If it affects the person, then the virus get killed through these antibodies. That's a natural defense mechanism. But they can get reinfected with other strains of virus. As we say, in case of dengue fever, a person can have dengue fever 3 times in his lifetime, because there is dengue 1, 2, 3 different types of dengue viruses. Similarly, there are different types of COVID viruses which mutates very frequently, and an individual once getting infected with COVID-19 can get infected with other strains of COVID, as we have different strains of COVID. So he can get reinfected with other strains, but not with the same virus. What I mean to say is,
Okay, one more question is, can tears from an infected person cause infection? And how effective is steam inhalation to be done at home?
body secretions, definitely, as I had mentioned in my talk, that the GI tract, that is mainly by passing stools, a patient can infect others. Through tears, there is no documentation or no evidence so far, like how many person have got infected by tears, because person should cry, then someone should, take the tears. That means he should lick the tears or he should inhale the tears, which is very rare. So this is more becomes a very dramatic scenario. So the question is good, but there's no exact evidence of person getting infected through tears, because there's so many secretions. We can't say, I have just only licked the tears, I have not licked the cheek, I have not licked, the saliva. You cannot say that. So that becomes very difficult to say, and there is no evidence so far to say from tears whether you get infected or not. But someone can spread the virus from, coughing. If he contaminates his eyes, the virus can enter the body through eyes as well. There is some documentation. Through eyes, the virus can spread, but tears as such, I have no idea, or there is no documentation so far about COVID spreading from tears.
Dr. Asif, Ayahs, do you want to throw some light on this thing?
Yeah, about steam inhalation, yeah, tears, I agree with Dr. Asif. Steam inhalation, there is no role. I mean, as I told you earlier, it can prevent nasal congestion, but not as a treatment for COVID-19, or doesn't have any benefit for COVID-19 infection.
Yeah, anything warm, because most of the people keep on drinking warm water, what we call as chool vellam in Malayalam. That chool vellam will be very, light, lukewarm. What I learned from, Mysore chool vellam thing. That reminds me of Asif Iqbal as well. So that lukewarm water is good, because that will be, it won't carry any bacteria and all. But if you drink too hot, that will damage your food pipe, which we call it as esophagus. So there's no point drinking too much of hot water or gargling with hot water. That will have a soothing effect, but it will not prevent the infection from virus as such. It can cause damage, and other bacteria and other viruses can infect that surface, and patient will be more prone to develop infection, rather if he consumes too hot water or he gargles with too hot water to use for. Thank you.
Okay. One more question is, can anyone clarify on asymptomatic carriers spreading the infection to others?
Yeah, sure, why not? Asymptomatic carriers, these are the individuals who will have the disease, but they'll not manifest with fever, cough, and cold. You can get infected with such individuals also. And for that, this norm of social distancing is for everyone, not only for infected person, but if you're going out, treat as if you are, dealing with infected people. Okay, so that's why this 6 feet distance, social distancing is must, because asymptomatic carrier, can spread the disease in COVID-19 as well, because there are many conditions where they are carriers, such as in cholera, in malaria, or so many diseases where they'll be asymptomatic, but they can spread the disease to others. Okay, so we have to be careful with COVID also. And there are many asymptomatic carriers. If you consider Indian scenario, around 70 to 80% of the people are asymptomatic in our scenario. They'll be just positive, but they don't manifest with the disease. Only 20 to 30% will manifest with cough, cold, breathlessness, or other manifestation of the disease. So we have to take precautions, not only with people with fever and cough, but also with normal people as well.
Dr. Hasib, last 2 questions, please. Last 2 questions.
Okay. Dr. Ayahs, how many testing centers are there in Bangalore, and can I get precautionary testing done? Dr. Ayahs?
Asif भाई फिर से बोलो.
How many testing centers are there in Bangalore? And can I get a precautionary test done without any symptoms or something, just like that?
Testing centers, actually almost all the government hospitals and those are testing. Even ये बैंगलोर में there are around 33 flu clinics. जैसे BBMP के hospitals हैं या primary health centers attached to government of Karnataka हैं, वहाँ पे सब flu clinics जैसे fever के clinics, जो भी any symptomatic any patient or child with fever, they or cough, जो भी symptoms of COVID के हैं, so they are being referred to those flu center fever clinics. वहाँ पे डॉक्टर स्क्रीन करने के बाद they send the patients to particular centers where the COVID test is being done. Right now, almost all the major hospitals, including like taluk hospitals, major जैसे मैंने 4 hospitals बताए थे बैंगलोर के. Apart from that, corners of Bangalore like KR Puram General Hospital, he said Elanka ki General Hospital, Nelamangala General Hospital. So almost all the major government hospitals are doing this testing. Apart from that, there are few like right now government has allowed even the private hospitals, major private hospitals also to do the testings. So if you are like if you want to get tested, yeah, you can walk into any one of the centers and get the test done.
One more question.
Dr. Hasib, one last question, please.
Okay. The question is there a limit to use the number of times hand sanitizers, or can we use it hundreds of times in a day?
As far as I know, there is no limit to use hand sanitizer, but you can use it more rationally whenever you feel that you're touched infected surface, or you're coming out from outside. You need to use the hand sanitizer. But you can use also, you can wash your hands if you feel that it's dirtied. You can wash with the soap and water. But you can use more rationally rather than, yeah, there's a tendency of becoming more obsessive compulsive, like what you call OCD. With these hand sanitizers. So better we use more rationally, but there is no limit for using.
Thank you very much, doctors. It was really a wonderful session. Now it's our duty to appreciate all our doctors. Let us give a round of applause, please. Everyone, please. Thank you. Now let us go for a short poll. I will give like 10 seconds for each question. We have like 3 questions.
Amin bhai, Wasim bhai.
Yeah.
Yeah, can I speak for a minute?
Okay, after this poll, please. After
Okay.
this poll. So we have one more question. This is the last question. Thank you very much. So we have vote of thanks by Dr. Asif. Over to you, Asif.
Okay. Assalamu alaikum, dear brothers. First of all, I would like to thank Allah Subhanahu wa Taala for giving us an opportunity to present this webinar. And on behalf of NMH Action Committee, I would like to thank our distinguished speakers, Dr. Ayahs, Dr. Asif Ali, and Dr. Asif Iqbal, for taking out their time from their busy schedule and presenting this webinar and clearing all the doubts which we had. I'm sure there are many more doubts and many more questions which we can deal in our group. And last but not the least, I would like to thank all the participants who have participated in the webinar and made this webinar a great success. Thank you all. Jazakallah khair.
Okay, thank you very much. I am going to end the session. Jazakallah khair. Sorry, someone wanted to speak.
Yeah, Wasim, I wanted to speak.
Yeah. Sorry for that. Yes, please.
Today morning, we had a seminar about Doctors for Humanity. That it was a webinar again. It was conducted by Dr. Taha Mateen and Dr. Saad Belgavi and Dr. Yunus Sarif from Bangalore. So, according to that, we have what attended, like each one of including doctor family and also apart from doctors, anyone who wants to volunteer, maybe it like in terms of monetary, waqt ke zor par, anyways. So I'll be inshallah, I'll be putting in the group. So today we had the webinar. So details maybe we'll be getting in a day or two. So who is interested in helping the patients, because we can see the situation in Bangalore, like most of parts of the India, like it's going out of control. We are not getting the beds. So people are planning out like something like home quarantine, something like that. So we need volunteers. So volunteers will not be like directly coming in contact with the patients, but in turn they'll be speaking with the patients. They'll be giving them moral support, and the patient, the persons who can support monetarily, like through the proper NGOs, and also that system is like being chalked out. So inshallah, I'll be updating in groups in a day or two maybe. So those who are interested, inshallah, can join. Thank you.